RSV is a common respiratory virus that usually causes mild symptoms, but it can be more serious for children and the elderly. According to the Director of Public Health, the outbreak at the hospital was identified very quickly, with measures put in place including enhanced cleaning, assessments and the use of antivirals for those deemed to need them.
So we've had one ward affected and a total of 9 patients and a couple of staff members.
How serious is this outbreak and how unusual is an outbreak of RSV as compared to seasonal flu, for example?
So this outbreak has been quite serious because some of the residents on the ward have been quite poorly, especially with RSV. RSV is a common infection in children and indeed we have seen an increase in some children's admissions this winter resulting from that. In this sort of more vulnerable cohort of patients on this ward, we've seen some poorly residents there, but we're keeping a very close eye on them and making sure that they're receiving appropriate care.
Dr. Carter says there's been an early surge in seasonal flu cases, adding this is not unexpected following 2 years of COVID social distancing and hygiene measures.
I'd like to remind the public it's not too late to get your seasonal flu vaccine along with your COVID vaccine. At the moment we're still offering to the over 50s, the at-risk groups, but we'll be keeping that under review and exploring with the GHA as to whether we can offer it to other age groups.
Well, as you mentioned, over the past 2 years we've seen COVID restrictions, but this year we're pretty much back to life as normal. So what is the COVID picture looking like for this year?
So at the moment we've got a low number of cases and that's good news. We will expect that we will have ripples of infection over the next 6 to 12 months, but at the moment we have a good vaccine match and, as I say, very low numbers of cases, so that puts us in a good position this winter.
And as we've heard this week, there's a chance that avian flu has come to the rock. Some dead seabirds have been found, and while it's not confirmed they died of bird flu, the Ministry of the Environment and Public Health are warning people to be careful.
The cases of avian flu in humans that have been identified, and these have been identified in Spain and the UK, tend to be in poultry workers who've come into contact with the dead birds. Fortunately, they've virtually had no symptoms, so that has been reassuring for us. But the risk is we have seen this month an increase in human seasonal flu, and is the concern around the mixing of the avian flu and the human flu, and that co-infection and that mixing can cause splicing together of the viruses and a new strain to form.
If you spot a dead or sick bird, you're advised not to touch it, but to report it to the Environmental Protection and Research Unit. The Ministry of the Environment adds it will become necessary to humanely decrease the populations of feral birds such as pigeons and chickens that come into close contact with people and are fed by them.